Welcome, Wealth Builders, to podcast number 84, Medicare Made Simple: How to Protect Your Health and Your Retirement. I am James Marshall, and this is 100 Wealth Building Secrets with James Marshall. Now, if you're turning 65 soon, helping a parent navigate retirement, or planning ahead for your own future, Medicare can feel incredibly overwhelming. I know this because I am dealing with it now personally. Now, there are many components of Medicare to consider: Parts A, B, C, and D, supplemental plans, advantage plans, enrollment deadlines, drug coverage, deductibles, penalties. So many things to consider. And somehow, every commercial makes it sound simple while leaving people even more confused. But here's the important thing: Medicare is not just a healthcare decision, it's a financial planning decision. And you know how I feel about financial planning. Because one of the biggest threats to your retirement savings isn't necessarily the stock market, it's healthcare cost. Today, we're going to break down Medicare in plain English and connect indirectly. Say that over again. Today, we're going to break down Medicare in plain English and connect it directly to retirement planning and wealth protection. And hopefully, by the end of this episode, you'll understand. And hopefully, by the end of this episode, you'll understand that Medicare actually, and hopefully, by the end of this episode, you'll understand what Medicare actually covers, the difference between original Medicare and Medicare Advantage, how prescription coverage works, how to evaluate plans wisely, the biggest mistakes new participants make, and how healthcare planning fits into long term financial stability. This is educational information, not financial or medical advice. But the goal today is simple. Help you make smarter decisions with more confidence. So let's get into it. Segment 1: What is Medicare? Medicare is the federal health insurance program primarily for people aged 65 and older. Some younger individuals with disabilities or specific medical conditions may also qualify. Now, most people become eligible at age 65 if they or their spouse worked and paid Medicare taxes for at least 10 years. It's called having 10 good quarters. Now, here's the thing that you need to understand. The first thing you need to understand: Medicare is not one single plan. It's more like a collection of different plans. You've probably heard terms like Port A, Port B, Port C, Port D, and wondered, what does all that mean? Is that one plan, many plans? What is that? Well, let's simplify it. Medicare Part A is hospital insurance. Part A generally covers hospital stays, skilled nursing facilities, hospice care, some home health care. Most people did not pay a monthly premium for Part B because they already paid Medicare taxes while working. But there are still deductibles and cost sharing responsibilities that you have, even if you did pay it while you were working. And Medicare Part B, now this is medical insurance. Part B is a little bit more involved and more detailed. It covers doctor's visits, preventive care, outpatient services, lab tests, medical equipment. And Part B does require a monthly premium. And this is important. If you miss your enrollment window, you could face late penalties for, say it over again. And this is important. If you miss your enrollment window, you could face late penalties that last for years. So it's important that you sign up when you're supposed to and get it complete before the deadline. Medicare Part D, prescription drug coverage. Part D helps cover prescription medications. Now, these plans are offered through private insurance companies approved by Medicare. Different plans cover different medications and pharmacies, which means comparing plans carefully is extremely important. Now, these are the plans you see on TV all the time, and you're just inundated with them. And they all seem to cover everything you need, and it's a one size fits all, but that's not true. Not every plan is best for you, so it's important that you know what works for you. And Medicare Part C is the Medicare Advantage. Medicare Advantage plans are private insurance alternatives to original Medicare. Medicare Part C, Medicare coverage. Say that over. Medicare Part C, Medical Advantage. Medicare Medicare Advantage plans are private insurance alternatives to original Medicare. These plans often combine Part A, Part B, Part D, and sometimes include dental, vision, hearing, and even gym memberships. But they work for very different, but they work very differently than original Medicare. And understanding those differences is one of the biggest financial decisions retirees make. And in this segment, segment two, we want to talk about original Medicare versus medical advantage. Most people entering Medicare choose between two main paths. Option one, original Medicare plus a supplemental plan and drug coverage. So you're taking the original Medicare and you're adding in a supplemental plan and drug coverage. Or option two, a Medicare Advantage plan. Let's compare them. Original Medicare. Original Medicare includes Part A, Part B, and it's run directly through the federal government. The pros of original Medicare is broad access to doctors nationwide, flexibility when traveling, easier specialist access in many cases, no restrictive provider networks for most services. This flexibility matters for retirees who travel often or live in multiple states, or have chronic conditions, want maximum provider choice. But there are some cons. The cons are original Medicare does not automatically include prescription drug coverage, dental, vision, or hearing. And there's no built in cap on annual out of pocket expenses. That's where Medigap comes in. Say that again, Medigap fills the gap. That's where it comes in. What is Medigap? Well, Medigap, also called Medicare supplement insurance, helps pay for costs original Medicare doesn't fully cover. Now, that may include deductibles, co-pays, co-insurance. Think of Medigap as financial protection against surprise healthcare bills. You pay a monthly premium, but many retirees value the predictability. So there's value to that monthly premium. So what about Medicare Advantage? Well, Medicare Advantage plans are offered by private insurance companies. These plans often advertise, as I was saying earlier. You see them everywhere. They have lower premiums, extra benefits, bundled convenience, and for some healthier retirees, they can work very well. The pros often lower monthly premiums, prescription coverage included, extra services like dental and vision, and out of pocket maximums. So there is a limit to what you might pay. The cons, network restrictions. Your doctor may not be in the network, prior authorization requirements, specialist referral rules, and higher out of network costs. So there is a trade off in there. You just need to determine whether or not it is worth it for you. Now, this is extremely important. A plan that appears inexpensive up front may become expensive later if your doctor leaves the network. We get to a point where we just feel like we can't live without that particular doctor. We don't want to change our doctor. So that's something you need to consider when you're deciding on which plan to use. If you develop health conditions, you require specialized treatment. These can be problems with the Medicare Advantage plans. Healthcare decisions are, in fact, financial decisions. And Medicare is really about managing future risk. And that brings us to segment number 3, how to choose the right plan. And choosing Medicare is not about finding the perfect plan. It's about finding the right fit for your health, your budget, your lifestyle, and your risk tolerance. These are the key questions you need to ask. Number 1, how often do you use healthcare? If you see specialists frequently, manage chronic conditions, travel often, want broad provider flexibility, then original Medicare plus Medigap may appeal to you. However, if you rarely visit a doctor, want lower monthly premiums, prefer all in one convenience, then a Medicare Advantage plan may fit better. What prescriptions do you take? That's a key thing to consider when making a decision as well. Always compare medication formularities. To say that one again. Always compare medication formularies. Say that again. Always compare medication, pharmacy networks, drug pricing tiers. These are the things you need to know when choosing. One expensive medication can completely change which plan saves you money. Are your doctors included? Before selecting any Medicare Advantage plan, you need to make sure your doctor is actually in that network or not. Confirm the doctor's participation. Confirm hospitals that are in the network. Confirm specialists that are accessible to you. Never assume based on broad advertising. You need to actually physically call your doctor and ask, do they take this coverage? That's important. Now, what matters more, lower monthly costs or predictability? Some retirees prefer higher monthly premiums to have a lower surprise of expenses. Others prefer lower monthly premiums but more shared financial risk later. This is similar to investing, isn't it? There's trade offs. You need to decide what's important to you. Some people value stability, others tolerate more uncertainty. So, your healthcare strategy should match your broader financial personality. A lot more to it than just choosing the best commercial and going with it. Now, do you travel frequently? Original Medicare often offers greater nationwide flexibility. Some Advantage plans work best within local or regional networks. So if you're doing cruises 2 or 3 times a year or traveling abroad, you might want to consider Original Medicare as opposed to the Advantage plans. Travelers should be careful to review the emergency and the out of network rules. You never know when something's going to happen. Segment 4, Medicare as a financial planning tool. This is the part I like best. Here's something many people don't realize: healthcare planning is retirement planning because healthcare costs are one of the largest financial expenses many retirees face. And the annual inflation on healthcare costs is about 5 to 7% a year. People spend decades preparing for retirement through 401k, IRAs, investments, social security planning, but many underestimate future healthcare costs. And that 5 to 7% inflation, that can be a hard obstacle to overcome. And one major illness can disrupt even a strong retirement strategy. So you've got to plan for the inevitable things that might happen. Protecting retirement savings. When financial planners discuss retirement risk, they usually mention inflation, market volatility, taxes, and longevity. But healthcare is another major category of financial risk. I mean, if you have a major healthcare situation, it can cost you $1 million for that coverage. And if it's not covered by insurance, it's coming out of your pocket, which is going to affect what you can leave behind to your heirs. Even with Medicare, retirees still pay premiums, deductibles, prescription costs, dental expenses, long term care costs. The goal is not simply obtaining coverage, the goal is protecting your retirement savings from unexpected financial shocks. Medicare is about predictability. Some retirees choose plans that cost more monthly because they value predictability. Say that over. Some retirees choose plans that cost more monthly because they value predictable healthcare expenses. Others accept more uncertainty to keep the premiums lower. Neither approach is automatically right or wrong. It just depends on your situation. The key is understanding the trade offs because financially secure retirees tend to plan ahead rather than react during emergencies. Emergency savings and healthcare. Say that over again. The key is understanding the trade offs because financially the key is understanding trade offs because financially secure retirees tend to plan ahead rather than react during emergencies. That brings us to emergency savings in healthcare. A strong retirement plan should include healthcare budgeting, emergency reserves, and understanding out of pocket limits. All that's a part of the emergency savings and the healthcare bucket. because unexpected medical events can create enormous pressure if you're unprepared. We've talked about long term care planning in a podcast all by itself, but it's worth repeating here. Long term care planning is another important conversation many families avoid. And it's in the same realm as Medicare. But Medicare generally does not cover long term custodial nursing home care. So don't think that if you have Medicare insurance, it's going to cover you if you go into a nursing home. It would not. Maybe the first 100 days gets covered. That's it. That means retirees may eventually rely on their personal savings, long term care insurance, Medicaid planning, and family caregiving. And as we've talked about in other another podcast, Medicaid planning is really difficult to qualify for, especially if you're someone listening to this podcast means you're someone of financial means. And qualifying for Medicaid is almost impossible. So keep that in mind. This is why healthcare planning and estate planning often go together. Healthcare and wealth building. At first glance, healthcare may not seem connected to wealth building, but protecting wealth is part of building wealth. Avoiding unnecessary financial shocks matter. Managing risk matters. Planning ahead matters. And retirees who understand their healthcare coverage often feel more financially secure because they are less vulnerable to surprise costs. I'm going to say that one again. And retirees often understand their healthcare coverage often feel and retirees who understand their healthcare coverage often feel more financially secure because they are less vulnerable to surprise costs. That's financial literacy. And financial literacy creates financial stability. That brings us to segment 5, common mistakes to avoid. Let's quickly cover some major Medicare mistakes. Mistake number 1, missing enrollment deadlines. That's a big mistake. Late enrollment can create permanent penalties. Your initial enrollment period usually begins 3 months before your 65th birthday and includes your birthday month, and it ends 3 months afterward. So mark these days. Strike that. So mark these dates early. Mistake number 2, choosing based only on commercials. Advertising can make plans sound universally perfect. They're not. So don't base your decision on the commercial. A plan that works well and for one person may be terribly wrong for the other. Mistake number 3, ignoring prescription costs. Always review medication coverage carefully. Prescription pricing can dramatically affect your total healthcare spending, and I mean dramatically. Mistake number 4, assuming Medicare covers everything. Medicare generally does not fully cover long term care, most dental services, routine vision, or many hearing services. These are not covered generally by Medicare. Understanding these gaps helps you prepare realistically. What would you do then? Build up your cash reserves to cover that, having your own gap insurance in some ways. Mistake number 5, never reviewing your plan again. Once you get it, you're done. Plans change yearly. You need to pull it out of the uh, drawer, look it over, make sure it still fits with your overall situation. Understand the networks, the drug coverage, and the cost. Make sure it still is effective for you. What are the benefits? Are the benefits still benefits that you need? Review your plan annually during open enrollment, which comes every fall. Every year, review that plan before you make decisions. Just like your financial plan. You begin the year reviewing your plan and you end the year reviewing your plan. Planning does not just stop and start once you complete the plan. It's an ongoing, living, breathing document, just like your healthcare position. Now, let's summarize. The biggest takeaway from today's episode is this: Medicare is not just about healthcare, it's about protecting your financial future. The goal isn't only living longer, it's living longer without financial fear. So take time to understand your options, compare carefully, budget realistically, plan ahead before a crisis happens. So that's important. Plan ahead before a crisis happens. Now, if this episode has helped you, share with a friend, parent, coworker, or loved one preparing for retirement. Because I believe you me, someone is 64 and they're thinking, what do I do about Medicare? And they may need your help, or this podcast may be able to help them. And remember, building wealth isn't only about earning more money, it's also about protecting what you've already built. Until next time, keep building wealth. Peace.